Hi, welcome to Bite Dentistry's Take Your Own Molds to Make Whitening Trays at Home. In your kit you will find all that you need to take an upper and lower impression of your teeth, which you can then send back to us by post, and we will make you an upper and lower tray to put whitening gel in order to get a whiter, brighter smile. The following DVD has been made to show you what to do in order to carry out this treatment successfully. In your kit, an upper impression tray shown in blue. These also come in yellow. If you have a wider mouth, wider arch, you may need to use a yellow one. We will ask you at the time of ordering which size you feel your mouth is and supply you with the appropriate size of tray. Then there is one for the lower arch shown here. You'll also be supplied with 4 plastic bags, 2 of which are full of a little blue ball of silicone putty, and then 2 of which have a little white ball of silicone putty. She's going to take a blue and a white ball and start to mix them together. You mix them in bare hands that have been washed and dried thoroughly, and you mix together until you have a homogeneous mixture, all a light blue colour. So Elizabeth is busy mixing. It usually takes about 30 seconds to mix it. You don't want to allow too long a mixing time, because if you wait too long, the heat of your hands plus mixing of the catalyst and base together starts the reaction to harden the mixture, and you could end up having the putty set before you've actually had time to seat it into your mouth. You then roll it into a nice little ball, shown here, and then make a little horseshoe shape which you place into the tray as shown. Place it into the tray. Don't cover over the palate because you don't want to make yourself sick. And then if you put this into your mouth as shown, like a gum shield, basically lifting it and pulling it over the front teeth, allowing a little bit of room at the front and pushing upwards until you cover all the surfaces of the teeth. You can pull the top lip over either with your fingers as shown, and then just let it relax. Breathe through your nose, take deep breaths through your nose. You may need a tissue at this point. You can close a little bit. It takes about 1 minute for the mixture to set, at which time you can take the putty out. We're just waiting for it to set. So this is shown in real time so that you can see what happens. If you don't have a hypersensitive gag reflex, you'll find this quite easy. If you do have a hypersensitive gag reflex, you may need to put your head forward and take deep breaths through your nose as shown by Elizabeth. Slow, deep breathing, nice and slowly and evenly until the mixture is set. The mixture sets more quickly on contact with heat, so when it hits body temperature it does set more quickly. Elizabeth's just going to have a little feel of it now to see if it's feeling pretty hard. Not quite yet, so just hold on. We want to make sure that it is a solid set, because that way we can ensure that all of your teeth have been recorded accurately and that there will be no drags or blows in the mixture. So we're coming up now for just about a minute. Okay, sorry, I'm making Elizabeth laugh. It's okay, I think that should be ready now. So the best way of taking this out is to slide your forefinger of one of your hands, whichever you prefer, up and over the back and pull down, and then you should see that you're able to see all of the teeth clearly. It's a beautiful mould taken by Elizabeth with many years experience, of course, but we don't need all of the teeth at the back to be shown, but we do need the teeth at the front and the sides as far back as your premolars to be shown. So you should have a mixture like this, and then if you can just rinse that under the tap and place it into the plastic bag as provided. You could also, if you want to, put Milton's fluid on it if you want to disinfect it, but that is not absolutely necessary. And then there will be a plastic bag provided, just pop it back into that, and then dry your hands and then start to mix for the lower one. the back of your mouth. So put it in like that, just slide it in and press down. Again, ensuring that you press down at the front and have enough room at the front. Just pop your head back, Elizabeth, please, till we see. Yeah, and then pull your lips over it. So you should have it nice and firmly down, front and back, and just allow that then to bottom and flick one side and then the other up, and that releases it, and then turn it round, rinse it under the tap, and then just let it dry a bit. You've got a tissue supplied, and you can see then that you can see all the surfaces of all the teeth, a nice rolled edge round. Beautiful impression taken by Elizabeth. And then if you can wrap those up and put them into the plastic bag, return in the padded envelope to us with your name and address, and we will then send out the bleaching trays to you, and we're going to show you how to load the bleaching trays. We make the bleaching trays here at Bite Dentistry. We will then return them to you with the bleaching solution, which is a gel form, and we will show you how to load the trays in the next section. Your kit will come with the syringes of bleach inside and 2 trays, an upper and a lower. Shown here is just an upper, and we are going to show you how much bleach to put in. The little syringes are inside. We will show you those in a second. The syringe, and if you take the tray for the upper into your hand, and then you just place a small amount of the bleach, a tiny blob. Let's see if we can get this in focus. Okay, there's just a tiny little bit inside. It's a little stripe, you can just see it here, and if you just put another bit in, Elizabeth, just to show exactly how much, just place a little blob of the gel on the front surface of the tray like that, and then seat this tray securely up into your mouth and leave it in there until the next morning when you take it out and rinse the gel out. Rinse your mouth out, use maybe a tissue or a piece of cotton wool to wipe the excess off, and then go about your business. And you will notice after about 3 to 4 days you'll start to get a colour change. After a week you should get the desired colour. You probably will have more gel than you need, but you just put a tiny bit. We normally recommend not going right round to the molar region because you don't really need to bleach these teeth. Probably just to the premolars, which is about at this position on the tray. Okay. Obviously, if you want to do your molars, you're more than free to do it, but you will use your gel up more quickly. And I'll just show you the inside of the kit. In your kit, you will find an instruction leaflet which reiterates what we've said about how to fill the trays, and there's also a box in which you'll find your bleaching trays. This is handy for future storage. Should you ever want to bleach your teeth again, it means you've got somewhere to keep them, and they can be reused after a couple of years. And then you get 4 syringes of the bleaching agent. You just use a tiny bit out of each syringe, or out of a syringe each night until that one is completed, and then start to use the next syringe and the next syringe until you're finished. You may not need to use all of the product to get the achieved desired effect. You can use as much or as little as you like. And if you have any problems, please call us on 0131 228 4030, where we're happy to answer any questions you may have about your bleaching kit.